Good morning or good afternoon. Thank you for attending today's presentation about the implementation plans to resolve the breast cancer medication supply and demand issues. Today, I will summarize the breast cancer medication shortage, its feasibility, cost-benefit considerations, risk mitigating plans for financial security, recommendation plans, benefits, and explanations as to why these plans are considered culturally sensitive, ethical, and equitable. The following slides will help you learn more about the shortage issue, particularly with breast cancer medications. They could also be possible scenarios for your profession to which you can relate. Towards the end of this presentation, you may also get ideas from the following planning recommendations that you may apply within your organization. Breast cancer is one of the leading causes of death for women. The shortage of breast cancer medication is crucial not only to patients but also to healthcare providers. Two of these drugs in shortage are cisplatin and carboplatin, which are the first line of treatment. The author's line of work deals with insurance, clients, and assists with shipping oncology medications. Having supply and demand issue with breast cancer medications adds up to more meetings and discussions on top of usual tasks, aligning additional formularies, additional coding and testing, and rebate plans for clients. The organization pays more on incoming and outgoing calls, extensive bidding plan to get the first available batch of drugs, financial impact in providing additional incentives, and possible staff error. Additional calls from and to frustrated patients or physicians and escalations are possible for all staff, overtime in place, minimal time off, which leads to burnout. A low retention rate affects the company and staff as it will reflect the intensity of the job and how the company handles the issue. The community is widely affected where financial and time adjustments are needed, extended administration, possible worse side effects, and may stay longer in the clinic. The feasibility of how the unfortunate event spreads out accompanies inconvenience in the community in general. The shortage can lead to high mortality rates, several treatment changes, inferior treatment, and medication errors. In 2019, 56% of U.S. hospitals reported changing patient care or delayed therapy due to drug shortages, while almost 37% said they had rescheduled planned or emergent procedures. Shortages can increase patient care costs in the organization, mainly due to personnel costs for managing pharmacy automation systems and electronic medical record changes. Furthermore, breast cancer medication shortages can cause high levels of stress and frustration for everyone involved. Drug shortages generally have tremendous financial impact on healthcare organizations. The company is expected to spend between $1,500 and $5,000 on each employee who needs software licensing to have the most up-to-date technology to capture the records accurately. Including hardware installation and employee training, a small practice may incur around $10,000. Dispensing errors for alternative breast cancer medications harm the financial stability of pharmacy, which involves an average paid indemnity of $52,031 for adults ages 18 to 64 and $78,321 for seniors, which the organization needs to anticipate since dispensing the wrong drug involves the substitution of another drug with a sound-alike name, which is very common with oncology medications. Unlike pharmacists, pharmacy technicians are non-exempt and get overtime pay per hour. In Nevada, the hourly average rate for pharmacy technicians is $19.16. The exact rate applies to new hires and overtime during drug shortages to ensure complete data entry. The cost per hour excludes performance incentives, which may take up to $20,000 budget for an average of 100 headcounts to motivate the staff. Healthcare organizations can do these top three strategies to alleviate possible financial instability. Education and training of all staff of the proper usage of the alternatives, optimize inventory management, and schedule stocked out medicines are critical to mitigating the situation. Management of current drug shortage by using drugs with minor defects such as improper packaging, labeling defects, and non-registered drugs after risk evaluation may help. And lastly, organizations should implement a plan for operation improvement, such as increasing communication among stakeholders to be transparent, and reporting and tracking system to report all related aspects of breast cancer drug shortage, including impacts and predict future shortages. The difficulty is the same with PBM working behind the scenes to approve insurance coverage for these medications. Healthcare organizations can partner with government agencies and manufacturers with programs to lower the cost of alternative products, which is called copay assistance. Search for other FDA-approved manufacturers. Looking for lower-cost alternative manufacturers to expand resources can be a significant help in managing the inventory. Conduct clinical surveys involving patients and physicians in different languages to assess the effectiveness of alternative drugs and determine which ones to retain and which one to discard. This will make them feel their feedback is valuable and considered by the company. Open communication involves transparency not only to consumers but also to staff. Employees should undergo intensive training and provide available resources as the source of truth. The ability to provide flexibility in drug coverage is a key support that a PBM can offer to the community to expand their medication options. The following proposed solution will benefit all areas of the community. The healthcare organization will expand its network, which entails broad access to new consumers. This will increase the organization's resources regarding marketing, brand awareness, and exposure. The plans will enhance the organization's credibility by providing better options and cost to the patient. The staff will have a better understanding of the breast cancer medications in shortage, utilizing the training materials when discussing with patients. This will also lessen the stress and frustration of the pharmacist and pharmacy technicians, which will help them perform at their best and qualify for company performance incentives as a reward. The patients and their families will have a broader option for breast cancer medications when a company implements coverage flexibility and expands manufacturers. Copay assistance will be available to help the consumers get the medication at a lower cost with less side effects. Physicians can provide insights about medication provided to the patient through the survey and can work hand in hand with pharmaceutical companies. The proposed solution plans related to breast cancer medication shortage are considered culturally sensitive. The plan for the survey is to present the questions in the top 5 languages of the community. For example, in Las Vegas, Nevada, patients and physicians can select English, Spanish, Tagalog, Chinese, or Vietnamese from the PBM letter or website to ensure that the content and messages are understandable to most of the population. If a specific language is not an option, a third-party translator over the phone is available to contact. Training will be provided to all staff, including the leadership team, irrespective of their personal or professional background. Being ethical is also part of the plan's consideration. Sharing each organization's core values to exhibit trust and ethics during collaboration is essential. Each organization should have integrity and be trustworthy by being transparent and working together towards the same goal. Healthcare providers should operate where respect is visible to patients, colleagues, and partners by getting their consent for important matters such as publication, financial matters, and essential information for the project's success. Finally, the equitable aspect of the plan is to make a majority of breast cancer medications accessible to diverse populations, regardless of their socioeconomic status, race, or gender. Coverage flexibility will provide patients and physicians with more financial options, supporting low-income families. This will reduce out-of-pocket costs for patients and meet the population's specific needs. These plans will benefit the organization by providing a range of options at the lowest wholesale price and high-quality products. Additionally, this approach will enable smaller manufacturing companies to earn rebates and incentives that they can use to enhance procurement and marketing. Thank you for taking the time to listen and learn more about breast cancer medication shortages and recommendations to resolve the ongoing issue.